Hey, Dr. Din here. Let's talk about dentistry.
All right, let's go over what is a root canal. A root canal is basically a procedure to take care of a tooth that is infected, or it's a procedure that helps you get out of pain. So basically, the reason why you're in pain or the reason why there is an infection is because there's bacteria growing into or inside the nerve space. If you take a look at your x-ray, you'll see that there's a middle darkness inside the tooth there. Inside that darkness is where the blood supply or the nerve is of the tooth. When you bite down, you can feel that tooth a little bit. And when you drink cold liquids, you can feel it. That's the nerve being activated. So if you ever see a cavity, a dark area around the tooth that goes into that middle darkness, that's when you hear us dentists recommend, hey, looks like you may need a root canal. That's one of the reasons. If you see a dark circle on your x-ray at the roots of your teeth, that could mean that you need a root canal. That is one sign and symptom that allows us dentists to figure out the puzzle. We clean out the nerve. We use something called sodium hypochlorite, whether or not you need a root canal. And so what we do is we drill through the tooth, through the top part of the tooth. We drill kind of like drilling for oil. You drill to hit the center of where that dark area is to access the nerve. Other word for it is called bleach. And so we use a very specific blend of bleach in order to clean out the nerve. It sounds weird, but it is the standard practice of root canals. It's been done for over 100 years kind of thing, and just the type of materials that we use. And so after we clean out the nerves, we use very, very, very small files to clean out the nerve. You can imagine some of the files are, the tips of it is zero 0.1 millimeters at the tip of the radius or diameter of the file there. And so very small areas, we have to use magnification in order to do a good job. Some offices have like 40x type of magnification with a giant microscope. Typically endodontists, the root canal specialists, have those types of things. And so once you drill inside, you clean up the nerves, you clean it out mechanically, and then you also clean it out chemically. And so there's a number of chemicals we use. We talked about sodium hypochlorite. There's other ones that we use I won't get into. But afterwards, we dry the canal and then we place a filling. And the filling that goes inside the nerve space of the tooth is called gutta percha. It's an inert, like it doesn't react with other chemicals. It's an inert material from the rubber tree and place it in. And so it allows the tooth space to be filled and prevents reinfection of the area. Once you get the root canal filling placed, you place the regular filling on top. And then if it's a back tooth, chewing tooth, the conventional standard is to have a crown on top of it. A crown is basically something that goes over the tooth so that you're biting on this one unit instead of biting on a piece of the tooth. A lot of times if you have a root canal without getting the crown, the tooth will break. The tooth will break if you bite it. Make sure you get the crowns on the teeth that need it. Those are the back chewing teeth typically. Or if a tooth is pretty broken down and needs something to hold it all together, crown is perfect for that. That's what a root canal is. There's even times where patients have extreme amounts of pain and no one can figure out what it is. And sometimes we have to do root canals if we want to try to take the patient out of pain. So root canals are a great procedure that us dentists do to allow teeth to live longer, as long as you take care of the teeth.